Hi, I'm Alex, the People's RN, an ICU trauma nurse here to help you navigate your healthcare and the healthcare of your loved ones. Today we're going to talk about tips that you can use to help your family member and healthcare team in the ICU. First off, I want to start by saying if you have a family member in the ICU, this is an extremely scary time, a time where we are so unsure of the outcome, we're vulnerable, and we're very anxious. I extend compassion to you if you're having to cope with someone in the ICU, and I encourage you to give yourself grace to feel everything that you're feeling. If you're feeling fear, if you're feeling worry, these are very normal feelings, and many times the ICU outcome can be unpredictable. These are moments where we don't have control at all about what's happening. Many times we walk into the ICU and we want to feel useful. We want to feel helpful. There's so much going on that as a person that's not in the medical field, you don't understand and you feel hopeless. This video is intended to help you feel useful in a very positive and beneficial way for your family member and the healthcare team. In our current healthcare system, we need all the help we can get as nurses and providers. So first, we're going to start with your attitude. When you walk into the ICU, I really want you to sit with yourself and decide, who do you want to be that day? What do you want to bring energetically for your loved one who is in a very scary situation, and for the healthcare providers taking care of your loved ones? Do you want to bring light to your encounters that day? Do you want to bring positivity? Lots of times when we enter to the ICU, we're getting a lot of information that's really hard to retain. If you're anxious, if you're coming in with this energy of fear, which is normal, but if you're not able to control it, it's going to be really hard for you to speak with the physicians, to make really important decisions, and to truly absorb the information and understand what is being told to you. But these are tips and tricks that you can absolutely implement from day one that will make a huge difference. Number one is attitude. Decide how you want to show up that day for your family member, and let's make sure that we are expressing love. Love heals, love is important, and compassion is important. The second thing I'm going to talk about is a warm blanket. The ICU is freezing. It's extremely cold. The patients in the ICU are receiving a ton of IV meds, which cause them to be even colder. So a nice warm fleece blanket will go a long way. Make sure to take it home every few days to wash it if you do suspect that your family member is going to be in the ICU for a little while. The third thing I'm going to suggest is socks. Fluffy socks will help this patient stay warm. I also want to add that if you're in the room and you just want to help clean your loved one's feet, many times nurses don't get around to doing this because they are concerned and they prioritize cleaning bowel movements, urine, avoiding pressure ulcers, changing the linens. And since feet aren't something that really get dirty, many times they don't get cleaned. But it's important to clean the feet because if they stay in socks for several days, they get really ashy and they start to peel from all the medications that these patients are receiving. So clean the feet and moisturize them. It's very important to moisturize. I've noticed that when you do moisturize, it really helps with the peeling and the cracking for a longer period of time. The fourth thing I am going to suggest is detangler. These patients that are in the ICU, many times they are sedated, they're intubated, they're not moving, and they can possibly be in bed for days without touching their hair. What ends up happening is that these patients' hair get extremely matted and full of knots, and it becomes impossible to take these knots out. When that happens, what I use on my patients is Suave Kids Detangler. It goes a long way. You can buy it anywhere and it works really, really well. The other thing that works well with this, the fifth thing I'm going to mention, is the wet brush. The wet brush is gonna get any type of knot out. It's not gonna hurt the patient, hopefully. It's gonna make it a lot easier to control that hair and just brush everything through. The sixth thing I'm gonna say is after you use the detangler and the wet brush, make sure to ask your nurse to braid the hair. What I usually do is 2 pigtails on the side. That's the easiest thing. And make sure that you have hair ties available to the nurses in a little drawer there that they can use whenever they give this patient a bath. If you are there and the patient hasn't received a bath, ask the nurse if you can help. Nurses can use all the help they can get. So if you walk in there with a willing attitude and saying, hey, I'm here to help, just tell me what to do, your family member will receive better care. I can guarantee you that. And the seventh thing I'm going to add to that is in the hospital, they don't wash hair in the ICU. I have not seen an ICU that actually has showers. These patients are bedbound, but the ICU does usually carry shampoo caps that look like hairnets. You can ask your nurse for these and make sure that when you do, you ask them to put these shampoo caps in the warmer first. It's really uncomfortable to put these caps on patients when they're cold, when the cap is actually cold. So make sure they get warmed up for about 30 minutes. They work really well and it really helps. You just put it over the head and massage the head and it helps get the oils out of the hair, okay? And the eighth thing I'm gonna talk about that you can really help your family member or loved one is bring music to the room. Lots of times the hospital can be a very sad, very depressing place. And we're hearing a lot of beeping noises. Even if your family member is sedated and is intubated, bring music if you know they like music. This is a big deal and will go a long way, okay? The ninth thing we're gonna talk about is body splash. Many times in the ICU, the soaps that we use don't have any perfume. And if you know that your family member is not sensitive to certain smells, even though they could be when they're sick, bring body splash. Ask your nurse to spray their beds, to spray their clothes. Many times the way that we smell really influences the way that we feel. So body splash is a huge thing. When you walk into a room and it smells like poop or pee, I mean, imagine you being there and just that room just smelling so daunting. So bring a yummy body splash that you know your family's gonna enjoy, okay? The 10th thing I'm gonna recommend is in the hospital, we have these wipes. They're called Cavi wipes, which disinfect serious bacteria, like it disinfects surfaces to kill serious bacteria and viruses. Lots of times nurses don't get around to disinfecting, surfaces at every shift. Wear gloves and ask your nurse for the wipes. And if you can, disinfect like the bed rails, the IV pumps, even the lines that are connected to the monitor. Sometimes those don't get changed out and cleaned. And you can try to avoid infection. Disinfect doorknobs where people come in and out, the bathroom. That would really help and keep your family member safe and hopefully free from any other infections in the hospital. And the 11th thing I'm going to mention is bring a cardboard with pictures and get well notes. Remind the healthcare team that this person is loved, that this person is someone that people are missing and want to come home. It's important to bring the humanity back into the patient for everyone. So bring pictures. Love is a big deal. Showing that this person is loved is a big deal. It's good for the healthcare team and it's good for your family member. If they wake up and that's the first thing they see, what a beautiful thing to be reminded how loved they are. If you found this video helpful and you have any questions, you can reach me at alexyourrn@gmail.com. Good luck, and I hope everything works out. Bye, guys.